This is Pat Salber with Health Innovation Media, broadcasting live from HIMSS 14 in Orlando. And interestingly, I have with me Orlando Agrippa.
Yep, nice to meet you.
Nice to meet you. And Ellen Derrico.
Hi, nice to meet you.
And they're with Qlik. And Qlik is a best-in-class, they tell me, business intelligence product. So I think I'll start with you, Ellen. What does Qlik do?
Qlik is a company that provides a business intelligence software to the healthcare community and other industries as well. Our business intelligence software allows users to have an end user experience and to have self-service business intelligence, which enables them to ask every question they want to answer and be able to look throughout their data and discover new and useful insights.
So when we were talking earlier, the way I was able to understand Qlik was to talk about your competitor, Cognos, who I think anybody who's used BI knows about Cognos. So you're a better Cognos.
We are a much better Cognos. We are best in class this year, as voted by all the customers in healthcare. And what that entailed is that class research went out and interviewed the customers using different BI tools, and we came out on top. We beat out SAP, we beat out Oracle, we beat out IBM and Cognos and Microsoft, as well as some of the discovery players like Tableau and TIBCO, Spotify.
So is this a David and Goliath story?
It is. We began as David, and we're now turning into Goliath as we grow up.
You got to be careful because there'll be another David around there somewhere. So Orlando, your title is content. So what does that mean?
Content. Well, I'm the deputy CIO for the largest hospital in the NHS. I'm also a massive advocate content of Qlik tool. I've used it for a number of years and have deployed it across countless hospitals. So in the NHS, we've got 160 something hospitals that have got Qlik or QlikView as a tool, and they use it for the exact thing that Ellen articulated in terms of discovery. But also from a healthcare perspective, it's how do we use BI, make BI nimble, easy to use, to help clinicians, help operational managers, help executives to make decisions to expedite the delivery of patient care, but also improve the delivery of patient care for better quality, shorter waiting times, faster diagnostics, and that sort of stuff.
So I tend to think of these BI tools being used on the business side of organizations. Are you suggesting this could also be used for something like population health management?
No, I'm not suggesting. It's definitely used for stuff like population management in a number of areas in the UK. So one of the things that we're working on at the moment is we are working with the National Institute of Healthcare Research in the United Kingdom, so on clinical studies, and looking at bringing in public health partners to use open data, which we already sort of use QlikViews or Qlik's tool to generate, to sort of give every hospital a lot more visibility of what's going on in primary, secondary and tertiary care. So it's definitely more than a management tool. It is a clinical improvement tool, in my opinion anyway.
Well, that's great, because that's clearly different, I think, from your competitors. So I want to ask you, so you're best in class and you're better because your customers said you were better. Tell me about a couple of the features that you think make you better and the reason why your customers love you so much. Like Orlando.
Sure, I'd be happy to do that. I think the biggest feature that we have that our customers really enjoy is the fact that they can keep asking question after question after question with using QlikView software, and they can get the answers to those questions without having to go back to their IT department or without having to go to someone else who is a statistician or an expert. They can actually themselves find the answers in the data to the questions that they have in real time and be able to share and collaborate with other people in the organization and make decisions right away on the fly with those key decision makers through the collaboration feature of the software as well. And those are two things that we have that really are very different from our competitors and enable our customers to more quickly make better informed decisions using all of their data and not just a subset of data, so they are able to really make clear decisions with those data. I think the other piece that's really interesting is that we're able to work with a number of different clients across both the business, as you indicated before, Pat, but also on on the clinician side, we have physicians using the software, and they're using it to look at their performance and to use better diagnostics with our patients and to improve the operating room capabilities and get utilization up there so that they can achieve a better quality of care for the patients, reduce the patient wait time, improve the customer satisfaction, and pull in some of that data that Orlando was talking about on population management to better serve the community.
So it sounds like one of the really powerful aspects of Qlik, if I understand what both of you are saying, is kind of a liberation of the clinician from...
Pat.
Huh?
It's a revolution.
A revelation, a revelation.
It's like wildfire, you know?
Yeah, and a liberation.
Yeah.
And who you're liberating me from are, my dependence on other people to get the data, like the IT people and
Exactly.
and the statisticians. So it sounds very powerful
It is very
and
powerful.
very interesting. So how can people learn more about Qlik?
Well, there's a couple different ways. We have a great website, www.qlikview, QLIKVIEW.com, or they can just Google Qlik. They can read about us on Yahoo. We are a publicly traded company since 2010 as well. And they can come to our booth here at HIMSS. We're booth 3111, very easy to remember. And those are the three basic ways they can learn a lot more about Qlik. Or they can go to their investment community as well.
Great. Any last
Excellent.
word? Orlando in Orlando?
Oh, well, well, I think, for the clinicians or the healthcare professionals at HIMSS, I would say it's something that they definitely should look at sort of exploring a bit more, because it's definitely provided healthcare, at least in the UK and other parts of the world, with demonstrable changes in terms of the delivery of better outcomes for patients. Yeah.
Okay, so there you go. Qlik at HIMSS, and I really enjoyed talking to you, Ellen, in Orlando, and I wish you the best of luck.
Thanks, Pat.
Thank you.